Amy and Ryan back here again to talk about Ryan and finding out how he had vasculitis. So he started out with some sinus pressure in his nose back in April, and we thought he had a sinus infection. Wasn't getting better, and he had to get switched antibiotics. We ended up going to see an ENTPA, and she switched his antibiotic a fourth time, and he went and had a CT scan. She had us come back in the next day and said that they didn't think he had a sinus infection and that he had a deviated septum with a bone spur, and wanted us to follow up with the MD. When we went and followed up with the MD 2.5, 3 weeks later, they found that he had weird crustacean and weird mucous membranes and did not want to do surgery at that time. So Ryan just wanted to follow up with him in about a month. So we just kind of went on our way. About another 1.5 to 2 weeks later, he ended up getting C. diff. Was on antibiotics for that and kept having weird, different muscle pains. He would tell me, I need a hip surgeon, I need a knee surgeon. Every day was a different pain. We had got his labs drawn when he was on the medication for the C. diff, and they were a little elevated, but pretty much normal. So they redrew labs again because we were switching medicines. And in the process of switching medicines, when he was almost done with the course, we got his labs redrawn, and they had started to go up. His white count was up, his liver enzymes were up a little bit. Our GI doctor recommended we go see our family practice, so we got Ryan into the family practice doctor, and he just thought all the medicines had been messing with Ryan. So he wanted us to get labs redrawn in a week. And when we went and got Ryan's labs redrawn in a week, his white count was up to 17,000, and his liver enzymes were up in the 100s, and he was feeling very sick. So the doctor told us he needed to see an infection specialist, and the infection specialist, I was worried we wouldn't get in for a while. And he, so then the doctor recommended that we go to the emergency room. So Ryan was admitted into the emergency room with sepsis. He spent 6 days, and they diagnosed him with endocarditis because he had micro blood clots on his liver, his spleen, his kidneys, but they were never able to see the infection on his heart. He also had the blood splinters in his toenails and his fingernails. So they placed a PICC line. We went home, and in the process of us being home and on him help, Ryan continued to get weaker and not better, despite having therapy come in and nursing come in to help him. We ended up going back to the hospital on July 31st, and when we got there, the doctor that was on the hospitalist said, I think you have this autoimmune disease. We're going to test for it, possible vasculitis. We got those results back Sunday, and he was positive. So they started his high-dose steroids. He got high-dose steroids for 3 days. That Wednesday, he ended up getting really confused in the morning and ended up actually pulling out his PICC line, and they could not draw labs. He had been having chest pain, and during that, they had to give him some medication to have him be calm so they could draw his labs. By the time they got him into the ICU and got him intubated, his labs his lactate was up to 27, and the doctors told us he was probably going to die. So as we were preparing for that, on Friday they actually extubated him, and he was awake and talking and just wanted to see his wife, me, and his baby, and know that he was okay and wanted to eat some food. He spent a week in the ICU, and progressively labs were getting a little better, kidneys were still getting worse, and they ended up doing plasmapheresis and dialysis. We thought he was going to be on his dialysis for 6 to 12 weeks. He ended up only having dialysis for about a week and a half. And then he was transferred to a long-term care facility, a long-term acute care facility. And he was there for 2.5 weeks. He ended up now with a collection of fluid in his back and had to go back to the hospital. And spent Friday night, Saturday night, Sunday night, Monday night, Tuesday night, Wednesday in the hospital. And on Wednesday, he was able to be transferred to Utah Specialty Hospital. And that was last Wednesday, so hasn't been here a week yet. And he's now continuing to get therapy, continuing to get better. But he does have some pneumonia, which is why he's on the oxygen, and we're gonna just keep showing and following, let you follow and see his recovery and how hopefully we just continue to get strong. Hey, Rice, say hi.
Hi.
He's doing so much better. We're so proud of him.